Tonight, Florida Governor Ron DeSantis declaring a state of emergency while announcing a new case of coronavirus in the state.
And the latest patient, a 60-year-old woman in Volusia County. There are now 18 Florida cases, including 3 in Broward County.
Tonight, Italy has expanded its lockdown to the entire country, directing its 60 million residents to stay at home and only travel if required by their work. Here in the U.S., the death toll from COVID-19 stands at 26.
And on Wall Street today, another market meltdown, the worst in 12 years. The Dow closed down more than 2,000 points amid rising coronavirus fears and sinking oil prices.
Coronavirus fears also taking a toll on the local economy.
And we have live team coverage from the cruise crisis to the mixed messages coming from the White House. We begin with our Louis Aguirre live with the governor's plan of action today. Louis.
Calvin, make no mistake, we are in the thick of this. The president may be trying to downplay these numbers, but we are in fact seeing more cases worldwide here in the United States and here in Florida. Hospitals scrambling to update protocols. The tourism industry taking a big hit as the governor increases the state's response.
I actually just signed before I came in here a state of emergency declaration.
As the number rises of positive COVID-19 cases in the state and the nation, Governor Ron DeSantis declares a state of emergency.
That allows us to create a unified command structure. It also allows, if need be, out-of-state medical personnel to operate in Florida. It allows us to more swiftly purchase any necessary supplies.
With 3 confirmed cases of COVID-19 in Broward County, lawmakers demanding the health department give the public more details about where the 3 infected have been.
Without the information of about how we had the cases occur in Broward County, then we're not going to be able to keep people safe and healthy.
The 3rd confirmed case, a 67-year-old man who works at Port Everglades, a 65-year-old man, and a 75-year-old man also receiving treatment. 2 of the cases connected to Port Everglades.
Not putting any information out there is tantamount to doing more harm than good.
Meantime, South Florida hospitals scrambling to put protocols in place to prepare for possible more patients and mitigate the spread of the virus.
We now have essentially 2 triage areas, one for patients who come in with flu-like symptoms, and the other for essentially all others.
At Memorial Hospitals, for example, emergency departments now triaging patients showing symptoms at the entrance of the ER.
We have a special route in each of our hospitals that they take to a special respiratory isolation room.
Both Broward and Dade also dealing with huge revenue losses in the tourism industry.
Millions of dollars. I don't have a percentage yet, but it's very serious.
Miami Beach already feeling the effects when the Florida Health Department posted this, advising Floridians who travel internationally to self-isolate for 14 days once they got back. It later revised it to only those who traveled to China, Italy, Iran, and South Korea. But then, what about all our international visitors who arrive here daily by the thousands?
You shouldn't have to interpret public health direction. It shouldn't be a Rorschach test. It shouldn't be a smoke signal. We need some metrics that we can rely on.
Yeah, and Mayor Gelber joining the chorus of city leaders and other lawmakers demanding transparency from our state government, from our federal government. You heard him ask for metrics to be able to measure and make informed decisions on whether or not to close, cancel, or quarantine and protect residents from the spread of this virus. We're live in Port Everglades. Louis Aguirre, Local 10 News.